Hello, my name is Rizka. Today I'm going to respond case study 2 in Casebook on human dignity and human rights. What the case?
This case tells us about Dr. M was an obstetrician and gynecologist. He performed an abdominal hysterectomy to Mrs. H, a 53 years old patient. Dr. M talking about the risks that might arise due to any surgical procedure to be performed Mrs. H, including infection after operation. After a long discussion, finally, Mrs. H approved the operation procedure. Dr. M had been suffering from epilepsy since 1989, information he did not disclose to Mrs. H. Dr. M did not suffer an epileptic seizure in the operating theater during Mrs. H operation. During the 2 days subsequent to the surgery, Mrs. H's bladder failed to function correctly because an incision had been made to the bladder, or cystotomy, during the initial surgery. A urologist was called in to repair the damage to the bladder. Early the next morning, Mrs. H passed away due to a pulmonary embolism in her lungs. And this is the question: should Dr. M have disclosed his epilepsy to Mrs. H prior to obtaining her consent to the surgery?
This is my answer. I don't think Dr. M has to disclose his medical history to Mrs. H because Dr. M also has the right to protect his privacy, including his medical history. And if the doctor can still do the surgical operation, besides he has a history of epilepsy, it means he indirectly asserted if epilepsy will not affect his performance, it can be seen by still recommending him to perform surgical procedures, including for Mrs. H. One thing to remember: after the patient has agreed to the informed consent, it means that the patient received all medical action that they will receive, including unwanted side effects arising after the surgery, so the doctor does not have to take responsibility for them. But if there are any error in operating procedure or diagnosis, the doctor must be responsible. So this is my answer. Thank you for watching.